And the fifth and final point about the characteristics of high-performing organizations is these are organizations that have generally developed effective team working, cooperation and integration. So effective intra-team working and effective inter-team working. So not just that the teams are functioning as entities, as units, but they're working effectively across boundaries. From our research, we would say that every team in every organization of any complexity should have as one of its key 5 or 6 objectives working more effectively and cooperatively with other teams within or outside the organization that we need to work with to ensure that we're delivering for the community. That makes sense? An absolutely key issue. A team-based working, whether we look in the manufacturing sector, in the oil and gas industry, in the finance sector, in healthcare, in education, team-based working is really a very important predictor of productivity and innovation. And it's ensuring that decisions are made by teams of people and at the closest possible point to the community, to the service user. So what we need to do is to make sure that we are building real teams in our organizations. So in the National Health Service in England, 95% of the 1.4 million staff say that they work in a team. We're not quite sure what the other 5% do with their time, but anyway. When we then say, does your team have clear objectives? Do you need to work together to achieve those objectives? Do you meet regularly to review your performance? To go back to Siobhan's point, actually 40% of people say in the English NHS they don't have regular team meetings. But when we use those as the simple criteria of team working, the figure drops from 95% to about 40%. So we think we've got 40% of people working in real teams, something like real teams, and about 55-60% of people working in pseudo teams. The more people working in pseudo teams, the higher the levels of errors which could harm patients or staff, the higher the levels of stress, and the higher the levels of injuries. The more people working in pseudo teams, the higher the levels of patient mortality. So 5% more staff over time working in real teams in a hospital is associated with a 3% drop in mortality. If we could increase that 40% of staff working in real teams to 65%, okay, just a 25% increase, at the most conservative estimate, taking account of all other potential confounding factors, at the most conservative estimate, that would be associated with the prevention of a minimum of 5,000 avoidable deaths a year in England in hospital. Team working is not just a nice to have in organizations, it's fundamental to the delivery of high quality services, to high quality performance. And that means that we need to develop our team leaders to ensure that they know how to lead teams effectively. So a lot of our leadership programs are focused on managing individuals rather than managing teams. But it seems to me it is of at least equal importance that we're developing people to lead teams as to manage individuals. And these are some of the key factors. We've talked about some of them already. They've come up in our conversation. Intense conflicts, chronic conflicts, are incredibly damaging to team performance. You know, there's no kind of two ways about it. If you have a couple of people in your team who have a chronic interpersonal problem, then that dramatically undermines team performance. And it's important, there's a clear norm that says you may not like each other particularly, but being a professional is about not letting your interpersonal differences ever get in the way of the performance of the team task. And it's about, as a team leader, valuing diversity. seeing that diversity in a team, if it's cultural background or professional background or experience, is valuable. When we have a clear shared vision for a team, and we value the diversity of the team, then those teams outperform more homogeneous teams in terms of both productivity and innovation. And it's leading into team cooperation. This is absolutely critical to team performance, of ensuring that we're always asking the other teams we work with, tell us how we're doing. How could we be more cooperative? How could we be more helpful to you? What do we need to do that will make your work easier? That's key to effectively integrated performing organizations. So a last point about team working is that we have found that teams that take time out on a regular basis to review what it is they're trying to achieve and how they're going about it are much more productive and much more innovative than teams that don't. And that's been replicated by research teams in probably a dozen countries around the world now. So part of our role as leaders is to interrupt the pathology of this relentless style of working that says we have to keep working flat out or we're not being sufficiently productive, because what our research shows really clearly, and in fact there was a meta-analysis published recently based on 49 separate studies showing that teams that took time out, had debriefs, were on average 25% more effective than teams that did not. So those are the 5 key cultural elements that we need leaders to focus on: vision, objectives, people management, innovation, team working. And I want to say a little bit about how we make that happen in practice briefly.